Yeah, this plagues everyone. All allergists, we have this idea of sensitization. So you've run an IgE test, and if the clinical history doesn't fit, then you're left with a positive result in a patient who may eat the food fine. And I think we all struggle with what do you do in this situation. And clearly one of the goals for us with the COFAR portion and being biomarker heavy is to try to figure out, is there a way that we can approach this to help advance the field from that dilemma?
Mm-hmm. Yeah, I mean, I definitely agree. There's so much interpretation that has to go into the testing that we have right now. I mean, I guess it gives us some level of job security in a way, but in all seriousness, I mean, these are tests, the blood tests. I mean, they are readily open for many other providers to use, not just allergists. But if they don't have the expertise to be able to interpret that, because right now they are very imperfect, I think it does set up a scenario where you're going to have all sorts of confusing diagnoses that are going on out there. So again, anything we can do to sort of tighten those tests up or come up with new ways to do it would be really, really helpful. I know Dr. Wood had talked a little bit about some of these alternative treatments, or not treatments, I'm sorry, diagnostic tests like basophil activation tests and some others. And it does sound like these are moving along, but I do wish they would come along a little faster.
Yeah, it's an interesting question. I have to say, from the alpha-gal syndrome allergy, you know, we are seeing two specialties that are really important for us. And one is dermatology,
Definitely.
where folks are coming in with particularly nighttime urticaria or itching that it seems to be elusive. So getting the word to the dermatologist that you can have a food allergy that presents not necessarily concomitant with
Right.
consumption of the food has been important. Secondly, for that AGS side has been gastroenterologists, because we're finding a lot of folks who complain of distinct abdominal pain, really without the sequelae that you and I would think as allergists we'd see. So that's been two that have been important for that side.
Yeah, I'd absolutely agree with both of those. Dermatology, I mean, skin being, you know, again, the most common presenting symptom of a lot of these reactions, and so dermatology and gastroenterology. And, you know, if you swing back to what we started the conversation about with immunotherapy and oral immunotherapy, there's been so much attention around sort of the GI system and how do they do. And so not only from the diagnosis initial, but even with the treatments, the gastroenterologists potentially are going to be very important.
Yeah.